it says speaker.
And then hang up.
Hello, everyone. Welcome to the State of Niche virtual business meeting. I'm Barbara Brickley. I'm the Managing Director of Niche, and I'm here today with our leadership team, Liz Azzuti, our Director, Linda, the Director of Education and Program Development, and Gray from TSI Communications, who leads Marketing Communications. So you could join us all today to do this, our very first virtual meeting, where we can report to you on our progress over the last 5 years and where we're looking to be in the future. Let's just start with who we are. The leaders in addressing the needs of hospitalized older adults. And we are, well, now we're in almost 500 hospitals in more than 45 states, as well as Canada and Bermuda. And we have almost 100 hospitals join us each year, hospitals as well as affiliated skilled nursing facilities. And do it. We know the facts. The Gray Tsunami will grow 89 million by 2050, more than double the current older adult population. Occurring at the same time, healthcare costs will increase by 25% by 2030, and Medicare spending will almost double by the year 2020. So we're aware of these issues. Everybody is, and it's not just a clinical issue. This is an economic issue, and this is also a public health issue, and this is a social issue. But on top of all of that, most into this field because you love caring for older adults. So also, one of the reasons why we do it, take this information directly out of the Institute of Medicine Future of Nursing report that was released in 2011. Should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. The United States has the opportunity to transform its care system, and nurses can and should play a fundamental role in this transition. The IOM report also talked about the fact that there are more than 3 million members of the nursing profession. It is the largest segment of the nation's healthcare workforce. And we know that there are a number of barriers that prevent nurses from being able to respond to rapidly changing healthcare settings and evolving healthcare systems. The IOM report talked about removing these barriers to ensure nurses are well positioned to lead change and advance health. And we do it niche. Are the leaders in health? We do it? Well, practice innovations and organizational tools that we have and offer at Niche have been developed in collaboration with our hospitals, as well as with faculty and researchers at NYU and other research institutes and hospitals. But you are doing the work, and we're doing it together. All of the research and evidence-based protocols, combined with the real-world innovations of hospitals, do build an outstanding portfolio of resources and tools that help you systemically change the care delivered in hospitals and other healthcare organizations. Our virtual collaboration, as well as our annual conference, are fertile ground for incubating ideas that we then together evaluate, test, and share. And I have to say this because I am not a nurse. Only nurses. Really, I've worked with many different groups of professionals in life, but only nurses could be so effective at collaborating and producing such great results. I'm fat, so I can do that. And how do we do it? Well, we share knowledge, we develop innovative solutions, we measure, we evaluate, we improve, and we disseminate. We disseminate a vast portfolio of tools and resources for hospitals and other members. And there's so much of that is also the peer-to-peer exchange that happens and occurs amongst our hospitals, both on discussion boards as well as at the conference, and just through email and other social media. We've been on the cutting edge of technology here at Niche. When we started the expansion in 2007, some people did say to us, you can't make this all online. Then our nurses in the hospitals, they won't adapt to this online education and collaboration. It won't happen. Well, it did happen. We have 20,000 users in our Knowledge Center and rapidly growing social media presence. Everything that we disseminate and you all use is available online and is successful because it is online. Really, this virtual strategy is one of the most significant contributors to our growth, and that's because of your ability and your willingness to adopt the technology or adapt to the technology. We can disseminate and share resources. So some of what we do, we talked about these numbers at our last conference, but they're very meaningful. We at Niche, and that's all you, impact more than 105,000 hospital stays per year. You care for almost 60,000 older adults each day. Engage almost 20,000 individuals in the Niche Knowledge Center. And so, in terms of the business of Niche, we want to take a few minutes to share with you or to, illustrate our membership growth. So in 2007, there were about 197 hospitals. There was very little commitment to being a niche hospital at that time. There were not fees. You didn't really have to engage in a renewal process, but there were a lot of people involved and passionate about niche and wanting to see this grow. So we started out with about 197. And today we have 423 hospitals plus 40 new hospitals in the queue who are starting their designation process next week. So that's more than 460 hospitals, and we have 45 affiliated sites, those skilled nursing facilities and other non-acute care facilities that work with our hospitals. So that is 500 plus members, and this is more than 140% increase in the past 5 years. I just want to note on the chart, the orange that you see on the top of the bars for 2012 and 2013, that color orange represents the affiliates, because in 2012 was when we first began accepting affiliated members. Those are the members that are not hospitals. So you really see the growth trajectory here. And so with everything we do, we have to look to the future, and this is what it looks like, or what we're projecting it looks like. Since we're growing by about 90 hospitals per year, we're expecting by 2017 that we will have 730 plus hospitals, and we may have 150 affiliates. Of course, that number could be much larger, the affiliate number, especially because as we develop more programming, we would probably increase those numbers. Our hospitals and healthcare systems have asked us and continue to ask us for more resources for affiliated organizations to help coordinate care. And so we are definitely working with our hospitals to provide those resources they need in order to transform care and meet the mandates and goals of the Affordable Care Act. So this is what our future looks like. I want to talk a little bit about the conference. We have grown, you know, for those of you who have been around for a while, the conference has grown up to be we had 750 in attendance, and we had to shut down registration because the hotel couldn't accommodate anymore. Again, on this bar graph, the purple are members, and the orange are the non-members. And we've really increased the non-member attendance, which is wonderful because once they come to the conference, they want to join the club. They really want to leave that conference. They are so impressed by all of your work, and they come back and they start their process and journey to become niche. Next year, I just have to tell you, if you haven't looked, the website for the next April 2014 conference is live. Registration will open in a couple of weeks, and we expect about 1,000 attendees, and that will be in San Diego from April 6th to 8th. And we have wonderful keynotes, including Diane Meyer, who's head of the Center to Advance Palliative Care. We also have Sister Carol Kinn, who's the CEO of Catholic Health Association, and our very own Eileen Sullivan-Marks, who is the Dean of the College of Nursing here at NYU. I also want to know that, and you know, we have built this conference. We've increased the quality and number of panel presentations. We received over 170 conference abstracts last month for our 2014 conference. So our conference committee is working on that here with the niche team to start to choose the panels and to invite others to present posters. Our posters and panels are the highlight of our conference and definitely the foundation for much of the new resources we create. And quickly, the future of the conference looks something like this. We're expecting it to grow each year, as it has in the past, and so by 2019, we're prepared to accommodate 2,000 people. And, you know, we have booked our conference through 2019, and all those cities are posted on our website. We really do need to have some pretty accurate projections on the growth in our membership so that we can actually secure the space. It's all very exciting to us, and if you would like to know more about how we created a sustainable business model to improve care of hospitalized older adults, we recently published an article in JAGS, or the Journal of American Geriatric Society, and it is available on our website. So this is definitely a collaborative effort, and in terms of the sustainability and the infrastructure we've built with hospitals and all our members, we've been very successful, and we're really excited to share this with you. Now, of course, we want to talk to you about all the wonderful resources and education that we have, so I'm going to turn it over to Linda Bob.
Thanks, Barbara. Really busy behind the scenes updating the Leadership Training Program, or the LTP, started in March, and that was one of the first things that I was charged with. So we began by updating the Planning and Implementation Guide, which is also on the Knowledge Center for anyone to use as a refresher. And then we updated the assignment sheets, or the work that folks do during the LTP, as well as 12 of the 13 webinars. We are putting an introductory webinar to kick off the LTP that explains the program, hides the LTP site in the new center, and gives folks an opportunity to ask questions right away. So a little bit more interactive right from the get-go. I added a call after the LTP is finished, and this is a way for folks to connect and how their action plan is working. And LC, our member manager is going to be doing monthly engagement with sites and offer kind of a reminder of the resources once they're out of the LTP. So over some of the other resources for niche, I know I was a coordinator, it was kind of hard to track, and looking back, I could have used a lot more of the resources. So we wanted to take this opportunity to review some of those resources too. On the column, you can see the core courses, the GRN, the GCA, or the backbone of niche. On the right side, some of the other knowledge center resources that maybe aren't used as often, but certainly are just as helpful for our niche sites. So, relational strategies that give you the tools to replicate the work done at other sites at your facility. Our clinical improvement models focus on clinical areas that have negative outcomes for older adults. We'll be updating those this fall. And then archived webinars, which are incredibly popular. The forums, now known as Niche Notes, offer the opportunity to reach out to colleagues across the country. The Joint Commission Crosswalk will be updated this fall, but we'll certainly provide the information that you need on niche resources and one use for a Joint Commission survey. The Media Kit gives you the resources to introduce niche to your facility, to your nursing leaders and staff, your governance committees, as well as your community. And Nancy and I are working on updating some of those as well to introduce the GAP and other resources to your staff. Education and resources of niche. This is our portfolio series as a map. It kind of maps out the resources of niche. Some of the topics I think would be really helpful for folks are the critical care nurse, the media kit, performance measures. We also have a new booklet that includes all of our resources in the portfolio series. For patient and family resources, our need-to-know resources are really very popular and really a great asset to the niche sites. We like the needs of older adults in the inpatient setting with the focus on safety and empowering the older adult and their family. We continue to look for new topics. We recently added palliative care and our work that we collaborated with CAPC, and that one is available now on the main website. I'd introduce Dr. Liz Capizzuti. For those of you who don't know her, she's amazing, to discuss the benchmarking and research with niche.
Hi, everyone. I'm very happy to be presenting on this virtual meeting. As you know, we've done, I think, quite a job with our benchmarking and research over the last few years in improving that for all of you. We published an article last year in the Journal of Clinical Nursing describing how we've been able to use the data that you've submitted in its aggregate form to demonstrate the relationship between a positive geriatric nursing practice environment and quality care for older adults. The article summarizes all of that work. And recently, there have been 2 articles published this past month in the journal Research in Gerontological Nursing. One of them by some colleagues of ours in Portugal that have done a wonderful integrative review about the GIAP, or Geriatric Institutional Assessment Profile, which gives great information summarizing how it's been used by various researchers and by, of course, hospitals like yourself in improving care. And in the same issue is an article by our group where we really discussed how this benchmarking database, again, assists niche sites in implementing their program by first doing a baseline assessment and for some of you doing some follow-up evaluations. And there's also some good information in there for those of you who may be thinking about repeating your GAP, and the information would be quite good for your IRB or other kind of applications. So please take a look at that, and I know we have links to these articles on our website. But what are we involved in right now? Well, currently, several of the sites are helping us with testing new GAP scales, subscales, and the process has been where we've worked with sites, conducted some focus groups to help inform the content of those scales, and right now we're testing them with actual niche sites so that we can do the formal psychometric testing. One is knowledge and attitude scales, those all being updated, expanded to different areas beyond the 4 areas that we've done before regarding pressure ulcers, falls, incontinence, and confusion. We're expanding it to other areas of knowledge and attitudes. And also, we're working with some colleagues of ours at Memorial Sloan Kettering to develop a tool specific to ambulatory oncology nurses. And again, we're recruiting sites right now who can participate in having staff complete those tools. So again, we can do the psychometric testing, and that in 2014 we can roll those out to you. And 2014 we will also be completing the development of additional surveys that will be specific to other types of environments such as long-term care, ambulatory, and home care. And the other thing that the other tools that you've been utilizing is our annual survey and self-evaluation. And this was implemented in 2010, and we thank all of you for your diligence each year in filling out that annual survey and self-eval. We know it takes a lot of time, but I think it's a wonderful self-assessment, and as well as helps you gauge your progress against other sites with these different levels of implementation. And as you can see, the progression from pilot sites in the early implementation phase, having a mission statement and action plans, to a fully integrated GRN program on multiple units with policies and initiatives that are embedded in the workings of your institution. Here on this slide, you can see that the majority of our hospitals are at the progressive stage, and this was a survey that was done most recently. It includes 286 of our member sites, 49 in the early phase, 135 progressive, 84 senior, and 18 exemplar. And we should also say that there was quite a large jump in quality, with approximately a 7-point increase between 2012 and 2013. So that really shows how much more you're integrating geriatrics in your overall site. And of course, I want to give a special shout out to those wonderful hospitals that have reached niche exemplar status. And now I'm going to turn it over to Linda to describe more about the future of niche.
Thanks, Liz. I did want to add on the next slide, or maybe you can wait. There are 18 exemplar hospitals, and I was talking with Emma today, we had 4 additional this week. So now we are at 22 exemplar hospitals. Langone, Halton, I hope I pronounced that right, Healthcare, in Fairfax Hospital, and Chilton Hospital were added this week. So very excited. We're up to 22 exemplar sites. So congratulations. Future of niche. As you can see, we had a really great response to our survey that we did this summer. To all of you that responded and volunteered, thank you. I look forward to working with you as we move forward. We have a wide range of roles of our respondents. Mainly, as you can see, it was the staff nurse. that took the time to respond. Almost 50% of the respondents were nurses. So thank you for taking the time to let us know what you think we should focus on. So, to begin, here's the breakdown of the areas you suggested for niche to focus on in the future. I'll get into a little bit more of the specifics in it, but as you can see, palliative care and stroke are the main areas that you wanted us to focus on. As Barbara mentioned, for our conference coming up, we have Dr. Diane Meyer, and we have some other panelists who are going to address area. Looking forward to having that at the conference. So, future of niche, additional topic areas that were suggested in the survey. There are a wide range of topics. We'll be addressing some of these topics, such as the request for more information on ACOs, geriatric, and advanced care planning at the conference in San Diego. As the CHF, we have Barbara Boxer, who is going to help lead the CHF specialty committee, so I'm sure we'll get some great resources from that committee. So some common trends were also included in the survey when we asked for additional information that you wanted to share with us. The comments you shared were to improve access to the site, improve ease of use. Our transition to net learning had a few bumps, and we appreciate your patience as we moved over to learning. But as this becomes more comfortable for everyone, it should address some of these concerns along with ease in managing the accounts. Hopefully you won't have to wait for us to upload all new users in the coming months. With the CEU comments, because there were many comments regarding is there a cost for CEUs, and I want to review that the CEUs for the board courses and all of the archived as well as new or future webinars, live webinars, are considered free for members. They do cost. Webinars have a cost associated with that if are non-members. So any of your listeners should know that this is free when they sign up for a webinar. LC Leadership Manager is improving the connection and outreach to our new sites after the post LTP time, as well as our legacy and other sites. We're additional education briefs for CNAs, and we'll be distributing the AARP work on caregiving for you to use at your site. So the future of niche, because overwhelming response to the call to participate in the subcommittee. As you can see, for palliative care, almost 900 people volunteered to be in the subcommittee, which would make it impossible to get any work done. We do have a core group who have done presentations or who are from our senior-friendly or exemplar sites that are going to be starting those different subcommittees. So the first one's ortho, stroke, lung care, and heart failure. 4 areas. Last week we had the first meeting for stroke and orthopedics. For stroke we have Emily Schaub, who is from New York. She's the co-lead of that group. And for orthopedics we have Anita Mahan, who came with some groups from an international standing. So we were very excited to have that once I figured out Skype. Next month, or this month I should say, in October, we have long-term care. And Kathy Herbert and Kathleen Flood are going to help me lead that group. And Jeff, which is Rebecca Boxer. So very excited to get these groups going. We've decided is because there was such a large turnout that we will offer a consortium or similar to a webinar, some kind of form for you to join our groups to regular, consistent basis. But we want to still reach out to all of those members who had interest in those different specialties. So look for more information in the spring. So you're aware, I know I presented this at the conference in April. These are the roles of subcommittees, and we're really looking to get some information out and some resources out to the different sites in these different specialty groups. To create need to know education brief. As you can see, we're looking to use the discussion forums as a way with the consortium or webinars to reach out to our different participants. We have almost 20,000 of you, so we want to make sure that we can get some of your feedback and share what we're working on. We're also looking to potentially have grant opportunities in the future so that we can really make sure we have a robust and especially for the long-term care and affiliates, as Barbara talked about earlier, that's really an area that we need to focus on, especially with all of our transitions. So at this point, I would like to turn things back to Barbara, and she's going to kind of sum up the meeting for us.
Thank you, Linda. One other piece of business I wanted to talk about is, as many of you know, we have partnered with Healthcare Source Net Learning to launch a new learning management system, or the new Niche Knowledge Center, and launched last week. Everybody's been transitioned over to the new system, and we are really looking forward to having providing you with advanced capabilities with this system. One of the hugest benefits is that you'll be able to actually embed our core curriculum and recorded webinars into your hospital's internal systems. Something that's been requested of us for many years, so we're really excited to be able to offer that. We're implementing some of the changes live as the system already launched, and there's always glitches, and everybody, there's a learning curve for everyone who's using the new system. So please, if you haven't already done so, start to use the system. We are scheduling and announcing, if they haven't already announced them, some live trainings for the coordinators as well as other users. And you can certainly call our office and speak to us with any questions or help that you need. So very excited about this, and we're hoping that everybody is having the opportunity to benefit from it. So with that, I do want to thank everyone again for being on the call, and we're ready to open the floor, or virtually, the chat for questions.
Great, thank you, Barbara. Now we're going to start the Q&A session. If you have any questions for Barbara, Linda, or Liz, please type them into the chat box, and we will answer as many questions as we can get to by the end of the 1 o'clock hour. If you have any questions at the webinar that you think of later, please email your question to info@nicheprogram.org. And I think this pertains to Liz. We have a question, would GIAP be changed to such a degree to impact comparisons by user sites from one survey period to another?
Thank you. That's a very good question. Because we'll be able to give you a general score, obviously it'll be a percentage score. You can look at that, but it will be different. So there will be a problem, moving forward once there are revisions in the knowledge and attitude scales. But that would be the only area where there would be revisions in the hospital side. Obviously, we don't have any of these tools for the other settings in place, so that obviously won't make a difference in the future. And in the hospital, we are just specifically looking at the knowledge and attitude scale.
Thank you. We have has the process changed to add and delete users in the new LMS?
This is Barbara. I will answer that. The new system actually allows us to have the coordinator have an administrator and more administrative abilities. However, we are encouraging our hospitals to still leave the user uploads to us because it's a bit of a complicated process. So while the coordinator can have more administrative function, we're still, wanting to handle that there. So as a follow-up, I'll give you the specific capabilities and answer to that question, make sure I'm answering it appropriately in our follow-up email, because Danielle Holness, who is now managing our e-learning center, might be cringing right now listening to this because I might not be answering it correctly, but I'm pretty sure that's the right answer. The system can do it, but we still will be managing it here. And again, I'll confirm that answer in a follow-up email to the group.
Thank you. Another question we have is, our facilities at the senior-friendly level, can we retroactively incorporate our health system into our niche designation?
Can you repeat the question, Marissa?
Sure. Our facility is at the senior-friendly level. Can we retroactively incorporate our health system into our niche designation?
So if I'm understanding the question, you have a hospital that's designated and has achieved senior-friendly status. Congratulations. Not quite sure retroactive extension. Every hospital in the system has to go through a designation process. We do have a discount on the annual fee for system implementation, but each hospital designates and also completes the evaluation and measures their every hospital independent of the other. So I think the answer is no, you can't retroactively or extend your designation to anyone, but you certainly, as senior-friendly hospital, can use that to help to support the other hospitals through the designation process.
Thank you, Barbara. Another question is a limit on the number of employees that can access the embedded e-learning?
So, Barbara, again, there is no limit. If you're getting the courses in your internal system, they're open to every employee in your hospital. Is for the system, if for some reason you are a hospital that does not have a learning management system, so you'll actually be utilizing everything via the niche system. We don't have a limit on the number either, and you could talk to us about if you have to upload mass users. However, if your hospital has a system, it's much easier for us to let you provide the core curriculum in this hospital system, and you would then use the niche system for the organizational strategies and other implementation tools that aren't the tools and resources that you would necessarily distribute to the entire hospital, but rather the tools that the people leading your niche initiative would use.
Thank you. Another question we have is a place on the site that lists each designation hospital by their level.
We list the exemplar hospitals on the site. We do not list the other site's levels. Every hospital is listed on our site without a level, and then independent of that, we recognize the exemplars.
Thank you. Another question is there a plan to develop a new GIAP survey that incorporated other important generic issues such as delirium and functional decline?
Yeah, absolutely. Thanks for the question. The knowledge and attitudes, for example, that will be for the hospital, and actually goes across all settings. The knowledge and attitudes definitely includes those topics. We had sent out some surveys in the past asking for what needed to be added, and that was certainly on the top of the list. So we did do that. Thank you.
Thank you. Let me get another question here. Any if you could get a list of niche coordinators out to all other coordinators?
The question was
It's always been our policy to not publish that information. You can definitely connect through the discussion boards, and we do facilitate, like if someone reaches out to us and asks if they can speak to someone else, we'll, contact them and pass it along. So that's pretty much what we do right now. We don't provide a list of coordinators because of privacy issues.
Another question, Barbara, I think that you can answer. Is there an additional fee to embed niche webinars and education to hospital online education? Is it limited to users?
No, for niche members, the webinars and the continuing ed or contact hours that those webinars provide are at no cost. Your annual fee covers all of that. For non-members, the webinars vary in price from $30 to $99. But if you're a member, you can have as many users attend webinars and earn contact hours as you'd like.
Another question is it too late to volunteer for subgroups?
Oh, send us an email. Send linda.bob@nicheprogram or at nyu.edu. Would love to hear from you, right?
Definitely. This is Linda. Because if you have interest, especially if it is your specialty or you're certified in a specialty, a small group to start. But if you have a really strong interest or you've done some work that maybe we're aware of, please email me. I'd love to hear from you.
And her email is up on the slide deck right now for that attendee. Another question is, will the opportunity for existing sites to view the new and improved LTP materials?
Well, great question. We haven't planned on it. So sure if that's something, hospitals do actually, train staff and they enroll in the LTP, one staff or more if needed. So it's hard for us to share, just make that public because that is actually the only thing that you're charged for at NICH is the leadership training. It would be difficult if we were opened up when all these other individuals were paying. But we can talk with our team and see if some kind of a preview. Now, the planning and implementation guide that has been updated, that's available to everyone. And we do have, some months ago, we updated the benchmarking webinar that's in the LTP, but that's also available to everyone on the recorded webinars. There might be some other pieces, but, something we can think of how we could share at least some of the information, and we'll get an email out to everyone. But thanks for asking. Something to think about.
And this is I've had opportunities to work with sites who have maybe out of the LTP 6 months or a year, where I've done a conference call. I've participated in some of the steering teams. So you're also welcome to reach out to me to see, is there a way that we can assist you, maybe not go through all the materials, but use the planning and implementation guide. Joe, who is our research coordinator, he and I have started doing calls with GAP questions. So LTP mentors have also participated in the calls. So that's why we're really trying to improve the engagement after folks are done with the LTP as well as our legacy sites. We want to make sure that we're meeting your needs. So if you feel like you need a little refresher or some additional help, please reach out to me.
The question we have is, in the old system, you can download the GRN modules so that you can present them live at your facility. In the new system, I heard you could download the introduction to, I say this wrong, gerontology. If you can, how do you do so?
This is Linda. I can take this one. Danielle and I are in the process of how LMS is set up currently, or the new Knowledge Center. We have to create a separate course for that, so we will be doing that in the next couple of weeks. If you have urgent need, you can reach out to Danielle or myself individually, and we can get you the PowerPoint. But at this point, we're in the process of creating a course for that will be available to coordinators.
Thank you. Looks like we have some new questions come in. I'm going to share again that if you have any questions after the webinar, you can email your questions to info@nicheprogram.org, and someone will get back to you. Let's see. Give a moment to see any questions. And we have is, so we can put the program into our learning site. Does it take IT to be able to do this, or is this something that we can do ourselves?
Do you want to answer that, or should I?
Either.
I think for most hospitals, Daniel on our team will have to work with your IT department to get the connection established. Right.
I think some of the sites have been contacting us, and we've even had some conference calls to make sure that it's the right requirements for your browser, for the pop-ups, other things like that. So if you are having some challenges, you're welcome to reach out to Daniel and I. We do have a user guide that we're going to update based on the information that we've had from user sites, requirements for the browsers. So certainly reach out to Danielle or myself. We will make sure that we're meeting your needs so you can get this up and going at your different sites.
Thank you. Okay, now we have it. Just to clarify, hospitals should still send lists of new users to niche in a provided Excel spreadsheet in order to obtain a login and password for each new user. Is that correct?
Dale has posted and disseminated the new user guidelines to everyone, and it's probably a different template, but yes, that is correct. There will be, you enter the basic information that you sent with the old system. We can do it much more quickly. The old system, we literally had to manually add each individual user, because it didn't have the ability to have these hierarchies. So each hospital was set up as a independent kind of space. The new system, even with us uploading it, we can do it sort of one swift download. You have to provide the same information, but we can do it much more quickly. And the exact template and instructions Danielle can provide.
Thank you, Barbara. We're getting a couple questions in regards to the PowerPoint, and that's a question that I can take on, and the PowerPoint will be posted to the niche website after the webinar. So I know we've had many questions in regards to wanting the PowerPoint, and you can get that on the website later on.
Okay.
I don't see more questions. I will give everybody an extra minute.
John Jorgensen is asking if this is recorded, and yes, we are recording it, right, Marissa?
Yes, absolutely.
And it will make the recorded version available.
Absolutely.
Another question coming in from Tylene Smith. So Tylene asking, will there be nursing quality data gathered in the future that we can compare ourselves to other niche hospitals, case, fall, skin, etc.? Well, we have that available now.
Yes, we do. We call it the unit level data, which is your NDNQI data and staffing data that you can upload to our system and then compare to similar niche sites, just like you do the GAP to other niche sites of the same bed size and teaching status. You can do the same, and we'll be putting out a benchmarking report soon. Right now, we're evaluating how much data we have in the system right now, if we can provide you with a meaningful report. That is, are there enough other comparative hospitals in there to do that? So, yes.
Thank you.
Thank you. That's me, Budai. I hope I pronounced it correctly, has asked a question about the subgroup for palliative care. That's one that we're certainly going to work on in the future. We are doing some, as I mentioned, the need to know with CAPC. We have some other kind of collection with them and how that's going to look in the future. We're not 100% sure, but as that plays out, then we certainly will have a subgroup with palliative care. Thank you for that question.
Thank you. Another question we have is, are we at liberty to share information from the niche website with other hospitals within our health system, i.e. education materials, EBP, etc.?
This is Barbara, and no, actually not really. The hospital, this is a membership organization, so other hospitals in your systems should become designated and members, and they are eligible to have access. So the answer to that is no, you cannot share materials. I mean, obviously, if you're doing a presentation and you have an initiative and you're utilizing niche as part of that, and you're crediting niche for something and you're not making money off of it, that intellectual property has not been violated, but you are it's not allowed that a hospital share their resources and tools with another hospital because they're not members and eligible to use that.
Thank you. Well, the question is, there be instructions regarding how to receive and upload hospital safety data?
Be instructions on how to
retrieve
data from where?
Sorry. Well, again, will there be instructions regarding how to retrieve and upload hospital safety data?
Oh, you mean the patient unit level patient quality data? We have that on the website, and you can contact our benchmarking service at any point, and we'll be certainly happy to walk you through that.
So if you go to benchmarking on the website, you'll find the information on the GAP as well as the unit level survey, and you can contact the info benchmarking at nicheprogram.org, and our team, in particular Joe Shulock, will
Thank you.
This is Linda. I see the question from Cynthia about doing some staff training to our 2 pilot units first and then identify our potential GRN candidates. I think some of the webinars are definitely a good choice. And when I was with the health system before I came to Niche, hosting some of the webinars was a good way to spur conversation and get interest. Some really good delirium archived webinars, as the Elder Speak, we had actually used as part of an action plan for some of our prescanning needs with older adults. So through the webinars might be a good starting point and kind of gain interest, as well as looking at your GF, if you haven't done already, Cynthia, to plan that and see what the needs are, and then you can address it based on the results of GF.
Thank you. Any more questions as of right now? We'll give everybody another minute just in case they have some last-minute questions. Again, if you have questions later, please email niche at info@nicheprogram.org, and someone will get back to you. Alrighty, I don't see any more questions. I'd like to thank Barbara, Linda, and Liz for presenting excellently to all of our attendees. Again, if anybody has any questions, you can email them at info@nicheprogram.org. And again, the presentation from today will be on the niche website. So that concludes our presentation. Everybody have a good rest of your day. Bye-bye.
Everyone.
Thank you. Bye-bye.